Eczema: basic causes, symptoms, and treatments. Eczema is the generic term used to name a group of medical conditions that show the skin being inflamed or irritated. The most common of this group is atopic dermatitis or atopic eczema. Atopic is used to refer to a group of diseases that comes with a tendency to develop other allergic conditions such as asthma and hay fever. This condition is often inherited. Prevalence: based on the latest findings, atopic eczema is increasing and presently afflicts around 9 to 30% of the population in the US. The disease is common in young children and infants. Most infants thankfully outgrow the illness around their second birth. However, there are some people who carry the symptoms of eczema all throughout their lives, although they usually are on a recurring basis. Usually, these symptoms can also be controlled. Symptoms: both itchiness and rashes occur on the skin sometimes. The itch starts before the rashes appears. The rashes are also on the face, hands, knees, or feet. On severe cases, the rashes and itch after many other areas. The affected skin usually becomes extremely dry, thickened, and scaly. With fair-skinned victims, these areas start with being reddish and turning into brown later. On darker-skinned people, the area will either become higher or darker. The rashes on infants sometimes produce oozing and crusting conditions on the afflicted areas. Usually, they occur on the face and scalp, but they can appear anywhere. In infants, the itchy rash can produce an oozing, crusting condition that occurs mainly in the face and scalp, but patches may appear anywhere. Causes: there is no cause discovered yet on eczema. Scientists, however, have found links in the disease and the overactive response of the body's immune system to unknown triggers. Eczema is found to be common in families with history on allergic and asthma. Contact with coarse materials can make the skin itchy. Too hot or too cold exposure can also trigger itch, as well as exposures to certain soaps or detergents. Animal fur and stress sometimes can trigger these flare-ups, sudden skin rashes. Luckily, the condition is not contagious and cannot be spread from one person to another. Diagnosis: they can be diagnosed by any doctor, but mostly by pediatricians, allergists, and dermatologists. Since eczema victims also suffer from allergies, doctors usually perform allergy tests to pinpoint possible trigger irritants. Children with eczema are usually tested for allergies. Treatment: before prescribing treatment, doctors usually determine the type of eczema, the severity, the patient's medical history, and other relative factors. The medication and other therapies is usually for each control inflammation reduction, loosening, and removal of the scaly lesions, and to clear the infection. Research shows that the most effective treatment of eczema, regardless of the type, is a combination of therapies to treat the skin and making drastic lifestyle changes of the skin. This combined effort increases the effectiveness of the medication. The medication is unique to the patient because it includes the type of eczema, past treatment, and its patient preference. Thankfully, there are many effective therapies available today to treat the many types of eczema, which cure most eczema can be managed. If you are serious about getting solution to your acne problem, make sure you check out this ad right here. This is the helping thousands of people getting solution to their acne problem. You can check it out instantly by clicking the link in my video below.